Happening now after passing a bill that would ban most abortions after 6 weeks in the state. Some South Carolina lawmakers pushing to expand access to birth control. A Senate Medical Affairs Committee proposing legislation that could allow women to get it without a prescription. Now, if passed, the bill would add South Carolina to a list of 13 other states that allow pharmacies to give birth control to women without prescriptions. Fox Carolina's Matt Koufax spoke with lawmakers and pharmacists about this and joins us live outside Fowler's Pharmacy in Greenville.
Yeah, Tori, well, some lawmakers believe that with the recent fetal heartbeat bill's passage, this particular legislation could be the perfect supplemental addition that helps with access to contraception. Now, other lawmakers think that there needs to be more discussion. One senator I spoke to says he agrees with the opinions of some local pharmacists who have some reservations about patient safety. State Senator Richard Cash says he wants to know how Senate Bill 628 would function in the marketplace.
A bill that would allow the patient to bypass an OBGYN or a family doctor.
Currently, you can only get condoms or morning after pills without a prescription in South Carolina.
This is a bill that's trying to balance increased access to birth control with patient safety.
Cash says his real concern is that there are many different types of contraceptive pills out there and that some pharmacies may not know complete medical history. He proposed an amendment that was added which would allow pharmacies to opt out.
Some pharmacists just may not have any interest in taking on something that they would see as the purview of a family doctor or an OBGYN.
In a statement, one local pharmacy, Fowler's of Greenville, says they believe this is a bad idea because of how each patient responds to different types of pills. They say giving the wrong birth control to the wrong patient by accident could cause health problems and have concerns about them not using pills correctly under these circumstances.
I would like to avoid a situation where we get into what I would call the dial-a-doctor situation, where they don't even have to go see the pharmacist.
If passed, the bill would also direct state medical officials to develop protocols for pharmacies to follow concerning both pills and injectable versions of birth control. Those would involve, at minimum, extra training for pharmacists. Cash says he's not sure he'd support the current version as it's written.
That's why I think it's going to have further deliberation.
Now, the bill's authors say they developed this after research showed how difficult it is for some women who live in rural areas to get access to those physicians who could prescribe those contraceptive pills. There is still a long way before this becomes a law, potentially, but Senator Cash does tell me that a debate where they examine this in depth could be held on the Senate floor sometime very soon. In Greenville tonight, Matt Koufax, Fox Carolina, the 10 o'clock news.